Quisiera yo pues destacar que el simposio denominado Medicina y Ética tiene una expresión muy importante por los temas que habremos de abordar. Desde luego el tema de salud mental es pues un problema de salud a nivel de nuestro país y del mundo entero. No dejaría de ir más allá que la perspectiva ética que tiene me parece muy importante y desde luego pues que lo impartirá nuestra académica Marilena Medina Mora, que no podría dejar de mencionar que nos incorporamos a esta Academia Nacional de Medicina en 1994, cuando fuera presidente un distinguido psiquiatra mexicano, el doctor Carlos Campillo Serrano. Pero el tema viene muy bien porque hoy ella lidera un grupo muy importante para nuestro país en relación a la salud mental de nuestros ciudadanos y estoy seguro que sus reflexiones serán muy bienvenidas. Pero qué más mencionar a Patricio Santillán Doherty, que si bien un cirujano de tórax destacado con posiciones muy importantes en la medicina mexicana, particularmente en el Instituto Nacional de Enfermedades Respiratorias, en esa dirección cuando vivimos la pandemia y que después me referiré también a propósito de la doctora Carmen Hernández, que establecimos ahí un hospital de campo, en que este hospital de campo junto con la Cruz Roja sirvió para atender pacientes graves comprobados por diagnóstico y pudiéramos dar una atención de cerca de 800 pacientes en terapia intensiva. Pero más allá de ello, hoy Patricio Santillán es nuestro comisionado nacional de bioética, para mí con una gran dignidad y presencia, y que desde luego también le agradezco cuando fuera miembro del Consejo de la Comisión Nacional de Bioética que yo presidiera. Pero el tema de dilemas bioéticos pues lo abordará desde la perspectiva que hoy en día él está viviendo en nuestra comisión. Sin embargo, hablaría de la doctora Carmen Hernández Cárdenas, que para mí es un orgullo que nos acompañe, directora general del Instituto Nacional de Enfermedades Respiratorias. Hoy en día, pues me mencionaré y seguiré haciendo alarde de ello, pues tenemos a la primera directora de la Facultad de Medicina, nuestra vicepresidenta, próxima presidenta de esta corporación, pero la doctora Hernández, para mí es un privilegio que esté con nosotros como directora de ese instituto y particularmente que fuera la titular de esta unidad que hacía yo mención anteriormente. Ella puede dar más información y desde luego fue un proyecto que yo creo que esta corporación, está aquí el doctor Gustavo de Anda, que hizo una recopilación de todas las actividades y ojalá el doctor Raúl Carrillo nos dé espacio junto con el doctor Santillán a presentárselos a ustedes. Pero Carmen, bienvenida, y mencionaba que al término de este encuentro la doctora Hernández debería de quedar con el compromiso de presentar su solicitud de ingreso para que nos privilegie desde la especialidad y la Dirección General del INER. Y desde luego ese gran amigo de la bioética, el comisionado estatal de Jalisco en bioética, el doctor Rodrigo Ramos Zúñiga, que hoy es un gran productor de información científica en su área de neurocirugía, pero hoy en día ha escrito y sigue escribiendo, le dará un libro a nuestra invitada, la doctora Woopen, sobre inteligencia artificial y que desde luego pues abre un espacio muy importante en este foro. Desde luego la inteligencia artificial en la medicina y la actividad científica tiene un gran impacto. Así que yo le pediría en este momento a la doctora Christiane Woopen que hiciera uso de la palabra desde esta tribuna para hablar del tema sobre salud mental, un concepto de trastorno ante visiones del ser humano. Gracias, doctora Woopen.
Appreciated Presidium, dear colleagues and guests, I can hardly express how grateful I am for this honorary membership in your appreciated National Academy of Medicine. And perhaps even more important than being honored or feeling honored is my happiness about the relationship we built between Germany and Mexico. So I'm not Germany, but the cultures and the approaches to do ethics together and to be in exchange and to engage in global summits, to exchange in in-depth discussions with students, so to encompass all levels of where ethics should be discussed. And I'm very happy for this ongoing relationship and say a very deep felt thank you. And now I come to my topic that is very dear to me. It is about mental health. I think patients with mental health disorders have been for a long time neglected, and over a lot of centuries, mental health disorders or mental disorders were conceptualized in a way that the people who suffered from them were not appreciated in an adequate way and were not dealt with in an adequate way. And you will understand my concern, especially regarding that, because of my ethical approach of life ethics, which I just started with a new Center for Life Ethics 3 to 4 years ago at the University of Bonn. And apart from all these ethical theories that are out there, we have one fundamental principle at the core of our ethical approach, and that is that the ethically good is to respect or to foster the flourishing, the beauty, and the fulfillment and abundance of all life. So it is not about saying what fulfillment means for every single person. It is not about saying how individual or social lives should flourish or should unfold, but it is to really think about what it means to lead a meaningful life according to one's own values, according to a culture, and according to what is really important for you. And this also, of course, applies for people with mental or other disorders. And I think doctors and the medical system has a special responsibility for those who are impaired in one way or the other to strengthen them to lead a meaningful life, even under burdenful conditions. So the WHO has a lot of engagement in mental health, and they stress in their reports that mental health conditions are very common in all countries in the world, but most societies and most health and social systems neglect mental health and do not provide the care and support people need and deserve. At least this is absolutely right for Germany. Yeah, if you have a severe depressive disorder, and I don't have to explain to you how burdening that is, it throws you out of your life completely, you have to wait approximately 2 months if you get a place in a hospital, or you have to even wait 6 months if you get an appointment to a psychotherapist in the ambulant health sector. Just imagine to have 6 months of severe depressive disorder. You need help immediately and not in 1 or 2 months or even 6 months or even sometimes not at all in specific areas of this world. There are several studies focusing on the impact that mental health has on the economy, on the healthcare, on the people, on the workforce, and so on. Here, just some figures. So they say 80% more people experience depressive disorders and 50% more people experience anxiety disorders as a result of the COVID-19 pandemic. And I can support that for Germany, especially the young people suffered a lot under the lockdowns and under having to giving up their relationships, not being able to develop and to flourish and to unfold their lives in such a precarious age. 30.9% of the world's population experienced mental disorders in 2021. So actually it's a population disorder, like diabetes or like blood pressure issues, like cancer or so. So it is not a seldom disease, an orphan disease, or something that is happening from time to time. It's really a population disorder. 71% of global anxiety disorders burden could be avoided if all people with anxiety disorders accessed optimal treatment. Yeah, imagine that level, this turning point that could be reached if you have adequate therapy. And 17.2% of the total years lived with disability in the world were due to mental disorders in 2021. Last numbers, this is the number of people with mental disorders by sex, more female than male people, but not so many more female people than male people suffered from that. And you see that it is almost 1.2 billion people suffering from mental disorders. So every third of every female or every fifth of every male person is suffering from mental disorders at one point in time. And also there are a lot of costs. 1.7% of the country's annual consumption in the US is due to the care for mental disorders or problems in workforce and so on. That's really a lot. So how to approach then therapies for mental disorders? Fortunately, there are a lot of drugs, but unfortunately, often we do not know which drugs are the best for that individual patient. So we can only try one and then after weeks or months say, well, it's not the optimal one, let's try another one. And we don't have enough biomarkers or other factors that we can predict what the success of the therapy will be. Also, we have not enough insight in the combination between drug therapy and psychotherapeutic approaches in different mental health problems. Another approach, also referring to artificial intelligence, is the effort of the European Commission and of course of other institutions as well, to have virtual brain twins. So to have a virtual brain from an individual with a lot of data from imaging, from questionnaires, from behavioral data, from molecular assessments, so that you can then, from the molecular level up to the networks, the bigger networks, a virtual brain twin where you can simulate the drugs and try to predict how this individual reacts to a specific drug or an intervention. This is a European project coordinated by eBrains in Marseille. It's called Virtual Brain Twin for Personalized Treatment of Psychiatric Disorders. We have the ethical part in it, and we focus on schizophrenia. And this was kind of the preliminary remarks. What is now important for me, also in this project, is to elaborate on the underlying images of the human being and of concepts of mental health that guide our research and also our treatment of people with mental health problems. And we distinguish three kinds of views. They do not necessarily exclude each other. They can be added up. They can be complementary. But I think at least the first two have their specific shortcomings. So first, there's the biological view. A according to this view, the human being is determined by its biology. You know perhaps all these discussions about the free will of the human being, of being determined by what your brain is doing. And then also in this virtual brain twin project or in other projects, you have a wording that immediately shows you that there is a biological understanding of the disease. So when you read main pathophysiological hypotheses are still debated, there is a dysfunction in neurotransmission and neuromodulation. Low dopamine levels are thought to be responsible for positive psychotic symptoms, and other things cause the negative symptoms. But it's all about the molecules and the networks and neurotransmissions. So there are biological explanations for schizophrenia. And there's something coming with these biological explanations, because there were studies that people with mental disorders, when they are told that there are biological causes or biological issues behind that, they feel less guilty because it's the genes, it's the biology, it's clear. But professional empathy from doctors declines. So if doctors think of the disease, it is a biological one mainly, empathy declines. I find that quite interesting because this has an immediate impact then on the doctor-patient relationship. And what goes up with a biomedical concept is a prognostic pessimism. That's also not very helpful for therapy. The perception of dangerousness of the disease and of unpredictability. So there are things coming with a biological understanding of a mental health concept. Then after the biological one, or with the biological one, another alternative is the biopsychosocial view. So that's a combination between biological, psychological aspects and social aspects, and the human being is understood as kind of a sum of biological, psychological, and social aspects. And this perfectly fits to the constitution of the WHO and the so-called definition of health that is in there already in 1946. That health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. They already pointed to the fact that disease and health is something that is not only a biological issue, but also entails mental and social aspects. And if you apply this concept, you go with the stress vulnerability model that is now prevailing in dealing with schizophrenia, saying that there are some biological determinants or biological vulnerability factors. And if you then, from the environment, experience some stress in one way or the other, then the disease will come up. But within this biopsychosocial model, there are no explanations as to how these aspects relate to each other and how they influence each other. So it's just a summing up of different kinds of aspects. And that is where the ecological view comes in. There, the human being is an embodied person in a natural and social environment. Yeah, it's not the solipsistic individual suffering from environmental factors, but being in a relationship, in an embodied relationship. And this is starting from the ecological so-called 5E paradigm of cognition. It means that the human body, the human being is always embodied. So all what you do as a living organism. We have our brain, we cannot do what we do without our brain, but our brain without our body can nothing, can do nothing, can think nothing, can deliver nothing, can effect nothing. So it is important that the brain organism is an embodied way of living. The second E is inactive, so we realize ourselves through intended acting. We cannot not intend something, and that's why also ethics is always part of the play, because we have to decide something. We cannot only lead our lives according to what happens, but we have to decide whether we do this or that and make our choices. The third E is extended. So the person extends beyond the limits of the physical body. So we have a relationship beyond the limits of this body. We can think even in continents and being in other times, in the future, in the past, with other people. So the person is just more than the body and the biological limits. Also, the person is embedded in situations and environments, so it cannot be in another way than being influencing the environment and being influenced by the environment. And the person is always emotive, so it's based on affectivity. We can try to be rational, we can try to use our ratio, our reasons to try to control our emotions, but there are always emotions with it, and we cannot other than combine it. And I think this is important for the interpretation of patients with schizophrenia as well, when distinguishing the micro, meso, and macro level. What I only want to hint to with this diagram is that we have different views. We have the first-person view, the second-person view, and the third-person view. As a researcher, as a medical doctor, we want to look at the third-person level. We observe something, we interpret it, and we want to act on it. We can see the body or the brain or the patient as a thing, a subject, of course, but as a thing outside of ourselves. The person itself has always the I, the first-person perspective. Yeah? I am suffering, and nobody can explain this I, because then you're already outside this I perspective. So only the I can tell you something about the I, and you're then necessarily the second-person perspective. Yeah? And important here is that it is the embodied subjectivity and the embodied intersubjectivity that plays a role in being a sick person, a person suffering from schizophrenia, and a person in a therapeutic relationship. And what does that mean then for schizophrenia and to interpret schizophrenia? I don't want to say that we don't need the biological level. That is important, and drugs can be very helpful and supportive, but they are not the whole story. So the primary experience of being a body as a matter of course is lost for patients with schizophrenia. And in its place comes an alienated body that often appears to the person affected as an external object that is only mechanically operated. So for them, the body is not the embodied subjectivity, but the perception that the body is someone else, or that the body is a thing that is not an embodiment experience. The separation between mind and body produces a Cartesian dualism, as it were. The mind becomes a hyper-reflective observer sitting in a machine-like body. And so the shift from a cognitive approach to one that is oriented towards the body and experience would be helpful to foster the therapy for patients with schizophrenia. So in addition to drugs and to other behavioral psychotherapeutic approaches, we could have body and movement-oriented musical and creative therapies. Sometimes they are already around, but perhaps they are still underestimated, at least at some points. So if you then apply the principle of life ethics, then we come to the conclusion that mental health care, starting from an ecological image of the human being as embodied person in a natural and social environment, should be followed. So we just want to bring it in all the discussions on artificial intelligence and virtual brain twins and all the other fruitful therapies that are already around. But of course, we can contribute a little bit also from this ethical approach to foster a further development. So let me then end with a huge thanks for your attention, and I bring it on the wall from Mitla on a temple over there or in palace, because these wonderful decorations, as we learned there, are the circle of life, and you will immediately understand that I appreciate that very much. Thank you very much for your attention.